Hi there, Dr. Tansavatdi here. So in this video, I am going to go over some information for the informed consent process for upper and lower eyelid surgery. Now, you should have received at this point documents in your email that has the informed consent process in a whole written document. It's pretty long, so this is the reason for this video, to give you some information about the document itself in more detail than what is outlined in that document. So if you do have questions, review this video and reserve it for the day of the preoperative appointment so that I can answer those for you. So let's start with what is upper and lower eyelid surgery and what will it accomplish. So for every informed consent document that you're ever going to sign for a surgery that is for an elective case, what we have to discuss: what is the surgery going to accomplish, what is involved in the surgery, so that's the details of the procedure, the risks that are involved specifically with the surgery itself, the alternatives of the procedure, so what else could you have done that would potentially accomplish something similar to what you're trying to do, and then so the risks, the potential alternatives, and then the benefits from the surgery itself. So I'm going to outline right now the benefits of the surgery and what it can accomplish, and then I'll go over alternatives, and then we'll go over risks. With risks, there are specific risks to eyelid surgery, and then there are general risks that are associated with any type of surgery that you ever have done. And so those might be something like infection, bleeding, healing problems. Those are true for all types of surgery. So let's start off now. I'm going to start off with talking about the surgery itself and what it can accomplish and what are the benefits. So upper and lower eyelid surgery is meant to address excess skin that may be sagging and covering over the lids themselves, the margin of your eyelids. They could also make you look tired. And so one of the reasons we do upper eyelid surgery is to improve your appearance so that you look more awake and less tired. So that's the description that we have that patients will come to see me for, and they'll say, I look tired. How do I look less tired? So that's what upper eyelid surgery can accomplish. Lower eyelid surgery can accomplish the same thing if you do have the presence of bags under your eyes and hollowing under the eyes. Now, some people will say, what about dark circles? If you do have dark circles, sometimes the bags themselves and the hollowing underneath is what creates the illusion that there's darkness under your eyes and that you look tired. The dark hollowing can be addressed with eyelid surgery. However, if you do have darkness, the dark circles under your eyes that's not related to hollowing, and that there might be some pigmentation issues, or a second issue might be vasculature. So if you do have prominent blood vessels underneath, you'll have this purplish discoloration, and that cannot be addressed with eyelid surgery. So I do want to stress that what eyelid surgery can accomplish for you. Eyelid surgery will also not remove crow's feet. So that means these lines when you smile, when I smile, I've got some lines too. So those lines will not be addressed by eyelid surgery, because the lines that show up are related to the muscles that are moving underneath the skin. The eyelid surgery itself does not address the muscles. Eyelid surgery will take care of excess skin that's creating the sagging. It will take care of bags, so they're taking care of the fat pads that we may be removing or moving to a new position. But it will not remove lines from the outside of the eyes that are related to the muscle motion. The other thing that it will not do for the lower eyelid surgery is that it will not remove what we call this orbicularis hypertrophy. You can get a bulge there, and if I smile, you see that bulge that I have right there? That is not a fat pad. That is not a bag. That is actually your muscle being enlarged when you smile. You have a strong muscle there. Eyelid surgery will not address that. So making it clear right off the bat, that's not what eyelid surgery will do. And that muscle, we can trim it down, we can try to decrease it, but ultimately that is genetically what you have and what you're predisposed to. And one of the things that we can do maybe is doing some Botox to minimize it, but it won't go away completely. So we can do things to minimize it. With upper eyelid surgery, one thing that it will not also address is if you have what we call lateral hooding, which is if the brow drops, then it creates this fold on the outside here. This fold on the outside is related to the brows dropping. And as we age, the volume around our eyes decreases, the bone structure also decreases in volume. And when that happens, the brow will drop, the eyelids will look heavy on the outside, and that is called lateral hooding. Upper eyelid surgery will not address that. And in those cases, I will address that with you in your consultation and at your preoperative appointment, that brow lift might be the better option for your surgery. So now that we've put that all aside, what can upper eyelid surgery and lower eyelid surgery accomplish? One thing that you will notice with upper and lower eyelid surgery is that you'll look less tired. You'll also look like you have more a rested appearance. Your eyes will look more open. And on the lower eyelids, you will look less like you've got the hollowing under your eyes. So those are all the things that upper and lower eyelid surgery will address. The excess skin in the lower eyelids when you smile, this bunching that you get, that's from the muscle motion. You want to look at the excess skin that you see when you're at rest, not smiling. That's the skin that we can remove. We don't want to do it when you're smiling and take that excess skin, because that is important actually with the stability of the lower eyelid. Okay, so now let's move on to alternative treatments. Before I get there, during the consultation process and the preoperative appointment, for lower eyelid surgery, I may suggest adding something called a canthopexy or canthoplasty. So this consent is to cover all that as well. Canthopexy or canthoplasty is where I tighten up the eyelid here, because if I notice that your eyelid is very loose, it pulls away from the eyeball itself very easily, or if I pull it away and it snaps back very slowly, then that means we need to do something to tighten the lid. Otherwise, you could have problems afterwards. That is one of the things we want to avoid, is this, what we call ectropion. So a canthopexy or canthoplasty may be added to your surgery as part of the whole lower eyelid surgery procedure. The other thing that we may want to suggest too is if you have what's called ptosis, which is the upper eyelid. It may not just be excess skin, it may be your muscle that's causing the eyelid to drop. So behind me I've got some blinds. If you see, I talk about this frequently, and that ptosis has to do with the strings that raise the blinds up. If those strings become loose and they get lengthened, that's what essentially what ptosis is from. It's the muscle that usually opens your eyes. It's called the levator muscle. There's also Mueller's muscle on the backside. Both of these muscles, if they get lengthened, can cause what we call ptosis. And ptosis repair can be combined with upper eyelid surgery to address the excess skin, as well as tightening that muscle so that we open up your eyes. So that's ptosis repair. So that can be done in conjunction with the eyelid surgery, and I may suggest that at your preoperative appointment or at the consultation process. It cannot, however, one of the things that we want to tell you is that upper eyelid surgery and lower eyelid surgery, there is no age-dependent result, meaning I can't tell you you're going to look 20, you're going to look 30, or whatever age that you might want to look at. You will look better. You will look more rested. You will look like a better version of yourself. That's, I want to emphasize that, because cosmetic surgery or elective surgery is not meant to give you a certain outcome of an age. It's meant to give you a better appearance to yourself, which people should not be able to notice that you've had surgery. They should say, you just look natural, you just look rested, and you look like a better version of yourself. Okay? So what are the alternatives to eyelid surgery? So one of the alternatives might be, and sometimes I do suggest this in combination with eyelid surgery, is CO2 laser resurfacing, or a chemical peel, or some other procedure to resurface the skin. And that being said, it's because the eyelid skin itself can be slightly loose, but not excessively. And in those cases, I might suggest CO2 laser resurfacing. It could also be, you could have, in my patients that I've suggested laser resurfacing in combination with the eyelid surgery, that you have enough skin that just removing the skin could put you at risk for other problems, like complications of dry eye syndrome, or another complication where the lid pulls away from the eyeball itself. So in those cases, I might suggest removing some skin, but majority of the skin will be tightening through the CO2 laser or chemical peel. So that is an alternative to eyelid surgery itself. It does not solve, though, this alternative does not solve bags. So if you do have excessive bags that are visible, this puffiness under the eyes or the hollowing under the eyes, CO2 laser resurfacing will not solve that. So what is the other option for eyelid surgery? The other option for eyelid surgery might be we do a brow lift. We talked about earlier that I may suggest that you're a better candidate for a brow lift. That would address the hooding of the lateral upper eyelids. That's another alternative. In the consent process, you'll see it says that other forms of eyelid surgery may be needed, and this is what we're talking about, where eyelid ptosis repair or ectropion, where the lid is drooping, that we might repair that at the same time of surgery. But I don't consider that truly an alternative. It's actually an addition of what we're doing with eyelid surgery. And then we'll go over inherent risks of eyelid surgery. So there are specific risks associated with eyelid surgery, as I alluded to earlier, and then there are general risks that's associated with any type of surgery you might have. And so they are something that can happen with any type of surgery. So specifically to eyelid surgery, the first thing that you're going to see on that consent, and I don't want to alarm you, the first thing you're going to see is it says blindness. What is the incidence of blindness? The incidence of blindness is about 1 in 250,000 cases. So that is very low. In my lifetime, I hope to be operating for a while, but I don't think I will get to 250,000 cases in my career. So most surgeons do not even see one case of an orbital hematoma that leads to blindness. So the reason why you could get blindness is it's a series of events that gets to that point. It's not that we hit the eyeball itself. It's not that we nicked a nerve. It's not that we did any of that. It's typically, with blindness, it occurs over a short period of time. It's an acute period of time, but it's something to note that the symptoms and what we'll get to that. So blindness occurs when there's what we call a hematoma develops. Blood is collecting behind the incision itself, and it's getting trapped in the orbit, around the eyeball. And what it does is then can push the eyeball forward within the socket and decrease the blood flow to the optic nerve, which is the nerve for the eyeball itself, to the retina, and giving you your vision. So if that optic nerve decreases the blood supply for a lengthy period of time, and that window is about an hour and a half that we have, then that will lead to blindness. That's irreversible. So what are the warning signs before we get there? So with that window of time, the warning signs are excessive swelling in one eye. Okay, this is not typical for both eyes. It's one eye, excessive swelling and excessive bruising, pain that is out of proportion. You take your pain medication and it does not cover it. And then the last part is the vision is diminishing. Now, again, it is asymmetrical, meaning it's one eye, it's not both. So that's the symptoms that you'll have. And the pain is a deep searing pain. It's not a pain that's like you've got one pain that people can describe is like they've got something in their eye, or they've got a scratch, or they've got like a cut on the surface that feels like it's sharp when they blink. That is a cut on the surface. That is not the pain that I'm talking about. The pain will be constant and always be there, not when you blink and stuff. So that's the type of pain that you want to look out for, and if you have any of those symptoms, you would be calling us right away. The phone number to contact me would be 805-715-4998 for the urgent line, or you would make a message through the Simplast app to myself. So next on that list will be what we call dry eye problems. This is something that can happen with upper eyelid surgery. less commonly with lower eyelid surgery. So dry eye problems can result because the tear production has been decreased. With upper eyelid surgery, the lacrimal gland, which is found underneath the brow bone right here on the outside, you can have swelling around that. You could, if I had to tack that lacrimal gland up because it has dropped, or what we call lacrimal gland ptosis, then that can also decrease the tear production. And then in itself, you know, the eyelid surgery, when we make a cut and we take out the skin, temporarily you can have lagophthalmos, which is a term what I call, it's the medical term, but what it means is your eyelid could be temporarily open because it won't close completely. And when it doesn't close completely, your eyes will have trouble with dry eyes because the tears that you create cannot be safely applied to the surface of your eye, because you've got to be able to blink, close, open and close completely your eyes to get the tear film to lay completely over your eyes. And so when you can't close your eyes completely after surgery with upper eyelid surgery, which is more common, then that can lead to the dry eye problems. Typically this is short-lived, so the dry eye problems are short-lived, and in the post-operative instructions it is that you should be using eye drops for the short, 1 to 2 weeks after surgery. But the other thing that can happen is it can become chronic. So dry eye problems can become chronic, and that can be related to just a decreased tear production totally overall, that it could be decreased. This is rare. It's not predictable who will have it, but I do find sometimes patients who come to see me and they've had upper eyelid surgery somewhere else that they do have dry eye problems. So this is not uncommon, but it is rare for it to be a chronic problem. All right. The next step down talks about ectropion. Ectropion is where the lid pulls away from the eyelid itself, or that it droops. So instead of it looking really up against the eyeball itself, it could droop. And with that, you can have, instead of dry eye, you could have a lot of excessive tearing because your eye is trying to keep the tears in, but it doesn't have that ability to drain through your lacrimal duct because the eyelid position itself is not holding things. So displacement of the lid from the eyeball is called ectropion, and that can happen from lower eyelid surgery. Typically, it happens if we've made an outside incision, and during the healing process, you've got a pull on the lid. That's what we call the ectropion. There are things that I'm going to be doing to guide you through the process to make sure that the area heals well. The other reason for the ectropion might be if you have swelling. There was an incision on the inside of the eye and you have swelling of the eyeball itself. We call that the scleral swelling, and that is also called chemosis. That swelling can lead to that yellowish color that looks like a gel or film on the surface of your eyeball itself, and it can push the lid forward. That ectropion that then results is usually temporary. As the swelling goes down, that ectropion will resolve. But small percentage of my patients after lower eyelid surgery can have that ectropion last longer. And there are instructions that I give to my patients to make sure that doesn't become a permanent problem. Rarely have I seen the ectropion last for a long period of time. So it's typically temporary and typically can be the first few weeks after surgery, and there are things that I will have you do if we get to that where the lower eyelids are falling down. So it is important that you follow instructions and also follow all your visits. Make sure that you're coming to your visits so that we can make sure that this condition does not last. Next thing on the list is corneal exposure problems. So again, we talked about earlier with the upper eyelids, if the upper eyelid, when we take the excess skin out, there is a period of time where there's swelling and the eye will not close completely. That's typically for the first 24 hours, sometimes can be longer, but usually it's gone within the first week, so it's not an extended period. But during that time, because your eyelids can't close completely, you can have that dry eye problem and you can have the corneal be exposed. And at nighttime, this is why we have you use the eye ointment. If you're not using the eye ointment, then what can happen is the eyes dry out, and if you accidentally rub your hand over your eyes, you can cause a scratch on the cornea, and that's called a corneal irritation, or it can lead to what's called a corneal laceration. And if that laceration does not get appropriately treated, it can then lead to blindness as well. So that is something you need to be aware of, that any irritation of the cornea, you'll feel it, and you'll need to let us know if you do feel a sharpness when you blink. That's the laceration or irritation that you're getting, okay? Eyelash hair loss. Eyelash hair loss is usually temporary. When we make the incision on upper eyelids or even on the lower eyelids, temporarily the lashes may fall out. Not typical, it's not very common, but if it does, know that it will all come back. So it's a trauma, not necessarily trauma to the hair follicles themselves, but trauma in and around the area, and the hair follicles can say, oh shoot, I don't like this, and fall out, okay? So that's temporary. Hair loss can be permanent, but I've not seen it myself, so I just wanted to let you know that. Next one on the list here, it says asymmetry. The two eyes, our two eyelids are not the same. Our creases may be different. If you look closely at myself, you may be able to notice it, but I do have a little ptosis in one eye where the eyelid crease is a little higher on this side and my brow tends to raise up higher. I do have Botox on right now, so Botox is sitting in, so you can't really quite see that, but the crease is a little bit higher. Everybody, naturally their crease may be different on the two sides. So we typically use, with the upper eyelid incision, your natural crease. I may change where that incision is placed. Sometimes I may place it lower or higher, depending on how much skin we want to remove. Typically, it's along your natural crease. So if your natural crease is different along the two eyes, I may try to get them more symmetric, but know that getting complete symmetry is hard if you already have asymmetry in your face, which is typical for most people. The lower eyelid would be the same. The shapes of your eyes also may be different. One eye may look smaller and the other might look bigger, and that will stay the same after surgery. So don't expect those mild asymmetries to change. All right? So that is with eyelid surgery to expect.